Now, earlier lectures about differential diagnosis and the drug interactions, they were a little bit lengthy, but I think doctors should not have any problem because they can swallow uh, maybe 1,000-page textbook, uh, and I mean, I can't believe that they have immense capacity to recollect that information in extremely stressful conditions. But let us do small cases, uh, a small prompt, as if one is doing actually practice, and one by one patients are coming. So this is first patient which has come. Please provide a list of potential drug interactions for a patient currently taking aspirin and warfarin. So patient has come and he is telling that I am taking this too. Now, you are planning to prescribe something, but you want to be sure about drug interactions. So it is telling that here is a list of potential drug interactions for a patient who is currently taking both aspirin and warfarin. You can understand the drug interactions are uh, spanning over such a long. So again, my friends, medical profession is not so easy, and within just a few minutes, the doctor's subconscious minds, I would say, an experienced doctors, goes through all this information and prescribes proper medicine. Okay, let us take another prompt. As I said, this time I want to go fast. So, next prompt. I will use new chat just so that previous memories are erased. Provide a list of potential drug interaction for patient who is taking amoxicillin, mox, a well-known antibiotic, and metformin. Now, a large number of Indian population or even world population is suffering from diabetes, and many are taking metformin, and often we get some infection and amoxicillin is prescribed. Let us see if it is safe to prescribe that way. It again gives that standard caveat that I am not a doctor and all that. So you should also not use this information on yourself or somebody else. But it gives that if somebody is already taking amoxicillin and metformin, then you should not prescribe these medicines. Okay, fine. Now, this is one more case, or I will leave this as an exercise. You will find it in the literature which is accompanying this lecture. Okay. Then let us take diagnostic reasoning. Patient will be hardly even educated, particularly in country like India, where he will be able to speak the names of the medicine and all that. He will just tell his complaint that I am having this complaint, and you will have to diagnose as a patient. So, patient presents with shortness of breath. Sometimes he will not be even able to describe this complaint. But suppose your clinic is on fifth floor, or suppose you ask him to undergo a treadmill test, then immediately you can yourself observe this particular symptoms, shortness of breath, chest pain, etc. So then, of course, here fever is also there. So patient is telling that these are the symptoms. Now, what is the most likely diagnosis? Again, it gives that caveat, I am not a doctor. But for shortness of breath, it gives this diagnosis occurs due to this chest pain is gives this, and I can tell it that please make your answer more detailed with each diagnosis as a separate bullet point, and let us see. Now, this time it is giving the name of disease, and that why it is giving uh, much detailed diagnosis or possible diagnosis rather, pneumonia and pulmonary embolism and myocardial infarction and pleurisy, and even included COVID-19, because I think it was trained up to September 21. So ChatGPT has seen COVID. Okay, fine. Now, this time let us take some new symptoms. A patient is reporting fatigue, muscle weakness, weight loss. And you can see that simple complaint, fatigue, muscle weakness, weight loss, for which we often do not even bother to consult the doctor, has at least one, two, three, four, five, and six possible diagnoses. So that's why the job of doctors is tough, and that's why it is a complex business, and that's why self medication should never be done. Okay. Then some exercises I have given, and you will find it in the accompanying material with this lecture. Please provide a diagnosis for the following patient, and this time a different symptom, this time a different symptom, and so on. Okay. Now, after diagnosis, next will be okay. Suppose you, as a not a chat GPT, but you as a doctor who is using chat GPT, has diagnosed the problem. Now the question is, what should be the treatment? Can ChatGPT help with that? So yes, it can help with that also, and we will see it in next lecture, or let us see in this one only. A bit longer, but I think what are the potential treatment options for diabetes? You can see that lifestyle modifications comes at the top. This is one important thing about modern medical practice, that even doctors are recognizing that the lifestyle changes are there. Then weight management is another thing. Of course, education and support is required for all. Blood sugar monitoring, medications also have their role in that. There are two types of diabetes, type 2 and then insulin type 1, that is type 2 requires metformin and type 1 requires insulin or some other medication. I am rather speaking from my limited knowledge, so just like don't believe chat gpt, don't believe me also. Okay. Then this is another, this hypertension you will do, infectious disease you will do. I am asking for breast cancer. It will start always with its usual caveat that I am not a doctor, but then it will suggest that there can be surgical treatment available, there can be radiation therapy available, there can be chemotherapy available, hormone therapy can be available, targeted therapy can be available, immunotherapy, and so on. So we just have idea that cancer means some radiation and surgery. Okay, this, but you can understand that even that is having further. uh, different types of treatment, and that's why a person spends years in studying and becoming cancer specialist or oncologist. Okay, but this